The topic of our assignment is Ayurvedic and allopathic approach in treatment of anemia or Pandu Rog. This assignment topic is brought to you by first year students of Gomantak Ayurved Mahavidyalaya and Research Center, Shiroda, Goa, namely Y. Vaibhavi and Urvi Bandodkar.
Case study number 1. This case study is being conducted to check whether the patient is anemic or not. The patient's name is Shakuntala Shetye. First we will check her eyes. As you can see, there is pallor in her eyes, which is the first indication of anemia. We'll then be checking her tongue. Now her palms, fingernails and palms for the presence of paleness. The patient also complains of fatigue and tiredness, and dizziness also, which are clear indications of anemia. Case study 2. This is a patient of anemia. We will first look at the primary signs and symptoms which are seen in the patient.
Name.
Ma'am, your name?
My name is Megha Elaguntla. I am suffering from breathlessness, weakness, and when I get up from bed, dizziness.
Okay. So these are basically the common signs, primary signs which are seen in an anemic patient. Anemia is a condition in which there is insufficient oxygen when the presence of hemoglobin and iron is less in your RBCs. At that time, there is insufficient supply of oxygen to the body. Hemoglobin is the pigment which is present in RBCs. RBCs are called as red blood cells. There are two types of cells in our bodies: red blood cells and white blood cells. White blood cells are basically involved in defense mechanism, whereas RBCs are responsible for providing oxygen to your body tissues. Now, when such a condition is seen in a patient where there is breathlessness, uneasiness or tiredness, fatigue, constant weakness, dizziness, breathlessness and chest problems, in such conditions it is said that the patient is suffering from anemia. And the ways with which we can prevent anemia is having iron-rich food like spinach, groundnuts, peanuts. It becomes especially vulnerable when the patient is a vegetarian, because iron-enriched food is basically meat-based. But when it comes to veg products, there are cereals, there are pulses, groundnuts, dry fruits, spinach are all the alternatives which we can use as iron-enriched food, which will help you prevent from becoming an anemic patient. And secondly, now what if we don't cure the anemia? Anemia is generally seen in women because they menstruate and they lose a lot of blood, and there is insufficiency of blood in women. And now, what can happen if anemia is not treated? If the patient is not treated properly, then the patient can suffer from organ failures or the systems in the body will not function properly because of inadequate oxygen supply, and also there may be cases of heart failures. So it is very important to prevent anemia at its basic primary stage, and this can be done by taking also iron supplements, vitamin. Anemia, symptoms, causes and treatment. Anemia is a problem of not having enough healthy red blood cells or hemoglobin to carry oxygen to the body's tissues. Hemoglobin is a protein found in red blood cells that carry oxygen from lungs to other organs in the body. Having anemia can cause tiredness, weakness, and shortness of breath. There are many forms of anemia. Each has its own cause. Anemia can be short term or long term. It can range from mild to severe. It can be a warning sign of serious illness. Types of anemia: aplastic anemia, iron deficiency anemia, sickle cell anemia, thalassemia, and vitamin deficiency anemia. Its symptoms: the symptoms of anemia depend on the cause and how bad the anemia is. Okay, so it can range from paleness of skin to tiredness, yellowish of skin, weakness, shortness of breath, irregular heartbeat, change in color of eyes, tongue, and chest pain, cold hands and feet, regular headaches, and rashes on the skin. Now we will look into the causes of anemia. Anemia occurs when the blood doesn't have enough hemoglobin or red blood cells. This can happen if the body doesn't make enough hemoglobin or red blood cells. Bleeding causes loss of red blood cells and hemoglobin faster than they can be replaced. The body destroys red blood cells and hemoglobin that's in them. Iron deficiency and poor diet, chronic diseases, vitamin B12 deficiency, folate deficiency causes the anemia and paleness of skin. The treatment of anemia depends on the underlying diagnosis. Iron supplements can be used for iron deficiency, blood transfusions can be used for blood loss, medication to induce blood formation may be used if the body's blood production is reduced. Drugs like iron supplements, vitamin B12, and folic acid supplements play an important role in the treatment of anemia. Diet like rich protein sources can be used to increase the amount of iron in the blood, and vitamin B supplements can be used for low vitamin levels. Infants, children, adolescent girls due to menstruation, pregnant women due to increased needs of iron, blood donors, vegan and vegetarians due to inadequate intake of iron rich foods, and also people with gastrointestinal disorders are at risk of developing anemia.
Let us now look at the Ayurvedic approach in treating anemia, that is Pandu Rog. So, what exactly happens in Pandu Rog? Pandu is generally considered as anemia as per Ayurveda. It is characterized by pallor, which is associated with different colors according to the dosha involved. Various gastrointestinal problems can also lead to the development of Pandu Rog. Most of these references have been taken from Charak Samhita Chikitsa Sthan, chapter 16, that is Pandu Chikitsa. So this chapter deals with the general discoloration of the body such as pallor, yellowish, greenish and whitish discoloration, which is seen in skin, eyes, lips, face, nails, urine, feces, etc. Kamala, that is jaundice, and types of Kamala are also closely associated to this topic. So here, in this topic, we'll be mainly looking at the general etiology, the pathogenesis, symptoms, etc. of Pandu Rog. So Pandu Rog is divided mainly into 5 types. Pandu Rogaha Smrutaha Panchavata Pitta Kapaistrayaha Chaturtaha Sannipatena Panchamo Bhakshananmrudaha. Pandu Rog is classified into 5 types, that is Vatik Pandu, Paitik Pandu, Kafaj Pandu, Tridoshaj Pandu, and the 5th one is Mrittika Bhakshanajanya Pandu. So what exactly leads to Pandu? Let us look at the pathogenesis of Pandu Rog. So when the Pitta predominant doshas get aggravated in the tissues undergo inflammation and they get weak and lax. Heaviness also develops in the tissues of the body. This pathological process leads to deterioration of Varna, that is the color, Bala, that is strength and immunity, Sneha, that is the unctuousness of the body, the protective fat buffer, and other qualities of Ojas. So Ojas is the sar or the essence of all the dhatus, tissues, and hence it represents immunity of the body. The qualities of Ojas go on deteriorating due to the complicated amalgamation of doshas and dhatus in a disease complex. The person in whom this pathology sets in will be left out with less blood tissue in the body. Anemia. Less fat, that is less insulation and protection to the body. There will be less tissue essence, that is Ojas, and the person will suffer from general weakness of the sense organs and of all the indriyas. The person will ultimately get Vaivarnya, that is discoloration, mainly pallor, and such condition is called as Pandu Rog. This is mainly explained and taken reference from Charak Chikitsasan, chapter 16. Now let us look at some of the causes. What leads to Pandu Rog? What are the causative factors? So some of the causative factors are Kshara, that is excessive consumption of alkalis; Amla, excessive consumption of sour things; Lavana, excessive consumption of salt or salty food; Atiushna. So this can be excessive consumption of hot substances or staying in the sunlight for too long. Viruddhahar, that is mutually incompatible food. Asatmyahar, same, incompatible food. Some of the food items such as excessive consumption of food items such as flat beans, black gram, paste of sesame, consumption of sesame oil, corrosive foods. Then some activities such as diva swapna, that is sleeping during daytime, excessive physical exercise, excessive indulgence in sex, doing any activities out of proportions. Then Rutu Vaishamya, that is seasonal incompatibility. Vegadharan, suppression of natural body urges. Fear, panic, when mind is afflicted with extra worries, anger, excessive grief. All these lead to the pitta located in the hriday, that is the heart, the sadak pitta, it gets vitiated. So this pitta, when it has gotten aggravated, it is thrown into the circulation through the 10 dhamanis, that is the main arteries, by the vitiated vata. So this pitta, being propelled by vat, reaches all the corners of the body. It finally gets lodged between the skin and muscles and further contaminates kapha, vat, and rakta, that is blood, twacha, skin, mausa, that is all the muscle tissue in the body. Then the pitta imparts turmeric, pale, and green colors on the skin and causes Pandu Rog. So these etiological factors are those which cause vitiation of pitta, which leads to the manifestation of inflammation in all parts of the body, which come into contact with the vitiated pitta in circulation. So the immunity deteriorates henceforth and causes autoimmune response. Since these causes afflicts the liver mainly and damages it, the inflammatory process first begins in the liver, causing autoimmune hepatitis. So this can further lead to Kamala, that is jaundice, and types of Kamala. Now let us look at the signs and symptoms of Pandu. So the premonitory symptoms of the disease are palpitations, unctuousness, absence of sweating, and fatigue. On developing the Pandu Rog, the general symptoms of the patients will be having symptoms of tinnitus, low digestion, weakness, prostration, disliking for food, aversion towards food, then fatigue, giddiness, pain in the body, fever, dyspnea, heaviness, and anorexia. The patient also feels as if the limbs are being kneaded, pressed, or churned. The patient can also develop periorbital swelling, greenish complexion, and falling of body hair. The person can also lose his body luster, the skin glow. The person becomes irritable, dislikes cold things, uh, feels dizzy, giddy, sleepy, spits in excess, aversion towards speech, and suffers from cramps in the calf region and overall fatigue, tiredness, shortness of breath. These are all symptoms and signs seen in a patient of anemia. So, what are the treatment principles? How does Ayurveda treat Pandu? So, mainly the principal treatment for Pandu would be Vaman, that is therapeutic emesis, and Virechan, that is therapeutic purgation. These are ideal choices. Whereas there are also classical medicines and home remedies that one can follow for Pandu on a daily basis until the situation gets better. A person can have Loha Bhasma, that is the ash of iron, with honey and ghee. Shunti Churna, that is dry ginger powder with Loha Bhasma. Loha Bhasma can be had with Gomutra, that is urine of cow. Turmeric powder can be had with curds early in the morning, etc. And there are many other rasayans, kashais that one can have. For example, luhasavam, lodhrasavam, drakshasavam, loha bhasma, rasa sindur, etc. Yoga Ratnakar has advised some patya and apatya that can be done in an anemic condition. That is, patya would be consumption of wheat, barley, the shali variety of rice, soup prepared out of jungle mausa, that means animals living in desert-like land, green gram, that is mudga, pigeon pea, masoor dal, etc. And apatya would be avoiding certain things such as heat of fire, excessive sunlight, physical strain, foods and drinks that aggravate pitta, excessive sexual intercourse, anger, strenuous work, grief, and all negative emotions. Thus, we come to the end of this video. Thank you very much.
So in this video, we'll be looking at
people from different age groups and creating awareness and telling them about symptoms and signs and different ways of treating anemia and Pandu roga. So here we have our first subject from the age group between 15 to 25. So during this age group, the cause for anemia could be heavy menstrual flow, heavy period flow. So sometimes you must have experienced this, right? So when is the time that you have to go to the doctor? So if you are experiencing a lot of body pain, a lot of cramps during menstrual flow, that is periods, then when your body is having a lot of weakness, when you have lost a lot of weight, when you have lost your appetite, that is you don't feel like having a lot of food, aversion towards food, then headache, dizziness, fatigue, all these are the pre-symptoms of anemia. So this is when you should consult a doctor. So in Ayurveda, mostly we believe that the food that you have is your medicine. So if you have proper food and you have proper digestion, that means you have a healthy life. So what kind of foods can you have to prevent or let's say avoid having anemia? So you could have iron-rich foods such as green leafy vegetables, nachne, that is ragi. Then you can have vitamin C rich fruits or foods such as oranges, strawberries, lemon. Include these in your diet, and also include that is cow's ghee, gauti tu. Okay, you have to include that in your diet so that it helps with your digestion. Now here we have some women from the middle age group. So आमी तेंकां तेजेर एनिमियाचेर आमी थोडे अवेरनेस आनी इन्फॉर्मेशन दितले. सो एनिमियान कितें जाता, एनिमियान मोस्टली बायलांक दादल्या परस रिस्क चड आसता एनिमिया जावपाचें. सो हें रिस्क चड कित्याक लागून आसता, सो मोस्टली एक प्रेग्नन्सीन जाता रिस्क, कित्याक आतां भुरगें आसता पोटान, सो आवयक आयर्न मातशें चड वापरप जाता. सो तेन्ना एनिमियाचें रिस्क जावपाक शकता. मागीर मेन्स्ट्रुअल फ्लो म्हणल्यार पिरियड्सान समज फ्लो हेवी ब्लिडींग जालें जाल्यार तेन्ना रिस्क चड आसता एनिमिया जावपाचें. सो हें प्रिवेंट करपाक लागून आमी अमके थोडे फूड आयटम्स म्हणल्यार आतां आयर्नान चड खंयचे फूड आयटम्स आसता ते खावंक जाय. म्हणल्यार आतां पाल्याची भाजी, ग्रीन पाल्याची भाजी, नाशणे, मागीर विटामीन सी आशिल्ले चड फ्रूट आनी फूड खावंक जाय. म्हणल्यार अशें आमट मातशें आसता पळय, अशें लेमन मागीर ऑरेंज आनी तसले फ्रूट खावंक जाय. म्हणल्यार एटलिस्ट ते सदां सुद्दां खायना, थोडे इन्क्लूड करूंक जाय डायटान. मागीर म्हणल्यार अशें बॉडीक चड स्ट्रेन करता तसलें काम खूब डेली बेजिसाचेर चड करूंक जायना. आतां तुमकां एनिमिया जालां तें केन्ना कळटलें, म्हणल्यार जावपाक शकता अशें. आतां तुमचें जेन्ना डेली अशें आंग उसळत रावता, बॉडी पेन जाता खूब, मागीर अशी डिझीनस म्हणल्यार अशें गुंळ येयल्या सारकें अशें जावप, अशी विकनस येवप खूब आंगान, मागीर धवसार जावप अशें स्कीन अशी मातसो कलर धवो जावप, मागीर भूक बरी लागप ना, जेवण नाका अशें दिसप, मागीर असलें सगळें कारण मातशें चड जालें अशें कंटिन्युअस मातशे वेळार आसता म्हणल्यार आसपाक शकता की एनिमिया जाला आसपाक शकता. ह्या टायमार तुमी डॉक्टरा फुडें वचूंक जाय. So now we have two people with us from the age group above 60 years. So in this age there is natural deterioration of the body, but I'll be giving them information and spreading awareness how to prevent anemia, or that is Pandu roga. So I'll be first asking them how they feel in this age. Like uncle here is a patient of anemia, and I'll be showing you some symptoms that are physical symptoms that I see in him. We check his eyes. You can see clearly that there is less blood in his body. Okay, show me his. Now we'll check this. As you can see, naturally there will be some symptoms, even if they are not severely anemic. But to avoid having anemia, they should follow certain things like modifications in their diets, such as including red meat, red rice, green gram, legume, then including ghee in your diet, that is cow's ghee, rauti too. This will help in your digestion. In this age, digestion, constipation is very common. So having good digestion, having good food ensures good health. So including ghee in your diet is good. Then you can include nachne, that is ragi in your diet. You can have nachne, bhakti and all that in your diet. In having fruits such as dali, that is pomegranate, then fruits that are rich in vitamin C, oranges, lemon, all that. This will help and ensure that you will not go towards that disease. And obviously not a lot of exercise because it's not feasible right now, but you can have small walks, short walks. And okay, yeah, how do you know when you have when you will have anemia? What are the signs and symptoms? So the signs and symptoms would be dizziness, fatigue, weakness in the body, trouble waking up. Uncle, you could tell me some of the symptoms.
Yeah. The first thing is this giddiness after getting up from the sofa and the car. And of course, tiredness from the walking, that's always there. That is to be there, yeah, whenever there was this. And after the weakness is always there sometimes, for 8 days, 10 days, like that, till you recover this one.
But you're feeling much better now.
Much better. I've been told by doctor to eat more fish, mutton because of the more protein in it, so I have to avoid it. But eggs are there.
You can have the other foods that
Other foods, vegetables and all
Some
these
of
things.
the
Carrots and all these things I eat and all.
beetroot, carrot.
Beetroot and carrots and all. Any vegetable.
Then some of the other symptoms would be breathlessness. Then when walking up the stairs and all, you feel tired.
Tiredness is always there when you walk up. I mean, when you start going up. Yeah. Till one floor is okay. Second floor, bit this one.
So now these are a few things that you have to keep in